Welcome back to the channel. If you're interested in gut health, digestive disorders, and understanding what's really going on inside your body, you're in the right place. Today, we're breaking down IBS versus IBD, two gastrointestinal conditions that are often confused, but are actually very different. Knowing the difference is critical because each one requires a completely different approach to treatment and management. IBS versus IBD. What's the difference? Although irritable bowel syndrome, IBS, and inflammatory bowel disease, IBD, can share similar symptoms, they are not the same condition. IBS is considered a functional disorder, meaning the bowel doesn't work properly, but there's no visible damage. IBD, which includes Crohn's disease and ulcerative colitis, is a true disease that causes inflammation and can permanently damage the intestines. Because of this, getting the right diagnosis is essential for managing symptoms and protecting long-term health. What is IBS? Irritable bowel syndrome affects how the gut functions. It can cause significant discomfort and seriously impact quality of life, from daily routines to social activities, work, and travel. Symptoms can range from mild to completely disabling. Many people with IBS also experience other functional conditions such as fibromyalgia, chronic fatigue syndrome, TMJ, or chronic pelvic pain. Who gets IBS? According to Digestive health research, IBS affects 10 to 15% of adults in the U.S. It's more common in women than men. It's one of the most frequently diagnosed conditions by gastroenterologists. Symptoms often begin in late adolescence or early adulthood, especially during periods of emotional stress. IBS versus IBD. Side-by-side comparison. IBD, classified as a disease, causes inflammation and intestinal damage, can be seen on scans and scopes, may require hospitalization or surgery. Increases colon cancer risk. IBS, classified as a syndrome, no inflammation or permanent damage. Colon appears normal on exams, rarely requires surgery, does not increase cancer risk. Common IBS symptoms. IBS symptoms vary from person to person and often flare after eating large meals or during stress. They may improve after a bowel movement. Common symptoms include ongoing abdominal pain, constipation, diarrhea, or both mucus in the stool, gas and bloating, feeling overly full, abdominal swelling. Urgent need to use the bathroom without relief. Nausea, important. Symptoms like anemia, bleeding, unexplained weight loss, or fever are not IBS symptoms. These may indicate IBD and require immediate medical attention. How IBS is diagnosed. There's no single test for IBS. Doctors diagnose it based on your symptoms, medical history, ruling out other conditions. Tests like blood work, stool tests, imaging, or endoscopy may be used, not to confirm IBS, but to exclude other diseases. To meet diagnostic criteria, symptoms must be present for at least 12 weeks within the past year, along with pain relief after a bowel movement. Changes in stool frequency. Changes in stool form. What causes IBS? The exact cause isn't fully understood, but research points to a miscommunication between the brain and the gut. In IBS, gut nerves are overly sensitive. Muscle contractions in the colon may be irregular. Normal stimuli like food or stress trigger exaggerated responses. This can lead to constipation when stool moves too slowly, diarrhea when stool moves too quickly. Triggers often include specific foods, stress, hormonal changes, and certain medications. IBS treatment options. There's no single cure, but symptoms can be managed effectively with the right plan. Common approaches include education and lifestyle changes. Diet adjustments and stress management are often the first step. Medication used for symptom relief in moderate to severe cases. Psychological therapies. Cognitive behavioral therapy, relaxation training, gut-directed hypnotherapy, and even acupuncture have shown benefits for some people. Treatment is highly individualized, so working with a healthcare provider is key. If you found this helpful, make sure to like the video, subscribe to the channel, and turn on notifications so you don't miss future videos on gut health, digestion, and food-based healing.